So welcome on my channel, that is the Charming Science, and I'm going to teach you about the clavicle bone. So first of all we have to know about the bone, that is the clavicle. It is the longest horizontal bone that is present in our body. It lies almost horizontally at the root of the neck. There are some features of the clavicle that it is the only long bone that is lie horizontally, and it is the subcutaneous throughout the life under the skin. It is the first bone that start ossify and is the only bone which ossifies in membrane. It is the only bone that having it is the only long bone that having the two primary center of ossification. There are some books which say that it's have the medullary cavity that is lies in the two-third of the shaft of the clavicle, and some say there is the absent of the medullary cavity. And there is also one controversial feature, that is the it is passed by the medial supraclavicular nerve. That is the characteristics of the clavicle. If we are going to talk about what are the functions of the clavicular, then there are the two major functions of the clavicle, that it supports the shoulder so that the arm can swing clearly away from the trunk. So generally when we are walking we swing our arm. So the clavicle is the only bone which keep the arm away from the trunk or the midline of the body. And the second function is that the clavicle transmits the weight of the upper limb to the sternum via the clavicle bone. So come and see about the clavicle bone. So we have the two view. Generally we see the clavicle bone in the two view, that is the superior view and the inferior view. While seeing it, first of all we have to know about that how we determine the sides of the clavicle. So while seeing the images, if we are getting an bone, so we have to see the flat ends. So the flat ends, it is the lateral ends. The flat ends or the lateral end is the acromial end of the bone, which is the flattened in structure and articulate with the medial side of the acromion process. Whereas the medial end or the external end, it is enlarged and articulate with the clavicular notch of the manubrium sterni and the first costal cartilages. If we see the sides of the bone, that which is the anterior side and which is the posterior side, so we see the convex forward from the medial side. From the medial side, if we see that the convex side is the forward side, and when we going to see the it laterally, the concave side is the lateral side of the the concave side is the forward side of the clavicle. The convex forward, it is also known as the anticurve in its medial two-third, and the concave forward, the retrocurve in its the lateral third of the clavicle bone. The female clavicle is typically it's shorter, thinner, and less curved, and much smoother than the male. And its landmark, if we are going to palpate in our body, then it's also very easy to palpate it. When we are going to the root of the neck at the jugular vein level, jugular notch level, at the jugular notch level, we can palpate the clavicle. And when we go toward the lateral end, at the posterior border of the lateral end of the clavicle, it is the roughly parabolic hollow under the lateral fibers of trapezius, the posterior border being formed by the anterior border of the spine of the scapula. The hollow will admit at least one palpating finger, If the pulp of the finger is placed on the spine of the scapula as far laterally as the hollow will permit, the nail will point to the posterior capsule of the acromioclavicular joint, and this landmark will always palpable. So if we are anyone is going to ask you that you can palpate the whole clavicle, so you can say that yes, I can palpate the whole clavicle throughout the acromioclavicular joint. So come and let's talk about the clavicle bone and how about its structure. So if we are going to see the lateral to fifth of the clavicle, so in the lateral to fifth of the clavicle, in the lateral side, we see that the clavicle have the flat structure and having a superior and the inferior surfaces. That one is the image of the superior one, and the another one is the image of the inferior one. The anterior border is concave. So if we see the anteriorly the bone, we say this is the concave structure that is present. It's the anterior part, and the convex is the posterior border is of the convex. The lateral fold with the rest of the bone is the conoid tubercle. A place the conoid tubercle is present and give attachment to the coronoid part of the corococlavicular ligament. This is the coronoid conoid tubercle that is present on the lateral fourth of the clavicle, and it's give attachment to the conoid part of the corococlavicular ligament. The trapezoid lines, if we see it in a inferior view, there is a sorry it's by mistake, there is the straight line. Yeah, this one is the trapezoid line, run forward and laterally from the lateral side of tubercle to the almost as far as the acromial end. The trapezoid part of the corococlavicular ligament is attached to it. A small subclavius is attached. Here is the subclavius group, it is present here, and the subclavius muscles will inside here on the inferior surface. The deltoid anterior and trapezius posterior are attached to the lateral to fifth of the shaft. So when we are going to see the deltoid and the trapezius, then we see that the deltoid in the superior part, so we see that it's the part where the trapezius will insert. It's the parts where the trapezius will insert, and this is the part. This is the part where the deltoid will originate. The deltoid anterior and the trapezius is this is the posterior part, and this one is the anterior part. So the deltoid is the anterior and the trapezius is the posterior, are attached to the lateral to fifth of the shaft, and the both muscles are directly inserted into the clavicle but are indirectly inserted into the clavicular peristeum. The corococlavicular ligaments attached to the conoid tubercular and trapezoid line. So while making the deltoid, it's gone. There is the conoid tubercle. This is the conoid tubercle that is present here, and the trapezoid line that is present on the inferior surface, that is the trapezoid line. Here the corococlavicular ligaments will attach, and this is the only ligament that help in the transmitting of the weight of the upper limb to the clavicular. If we are going to see the middle third, if we are going to remove these things, If we are going to see the medial 3/5 of the shaft, then we see that the is a cylindrical in shape. If we are see the mid shaft of the clavicle, then we see it's the cylindrical in shape. The lateral end is a flattened. The medial end is the quadrilateral shape, and the mid shaft is in the cylindrical shape. And if we take the cross section of the clavicle, then we see that it is in the oval shape. But it is smooth and rounded laterally, where it's from upper body of the infraclavicular fossa. There is the structure that is the infraclavicular fossa. it form it roughened medially and smooth laterally. Its margins give attachment to the costoclavicular ligaments. If we are seeing toward the side, it's the superior surface. In the inferior surface, if we see, then we see that its margin, this is the place where it's give attachment to the costoclavicular ligament, which connects the clavicle to the upper surface of the first rib and its cartilages. The 3/5 provide attachment to the pectoralis major. We are seeing the inferior surfaces, then the pectoralis, this is the place where the pectoralis major is attaching. The clavicle head of the pectoralis major is attached. The sternocleidomastoid is attached to the medial half of the stern. This is the place where the sternocleidomastoid will originate. It is the place at the medial half of the superior surface, but the marking on the bone is not much visible or the palpable. The smooth posterior surface is devoid of muscular attachment. So the smooth posterior surface, that is the posterior surface, is devoid of muscular attachment except at its lower part immediately adjoining the external end, where the lateral fiber of the sternoids are present. Only the sternoid muscles are giving attached at the middle of the shaft. Medially, this surface is related to the lower end of the internal jugular vein, from which it is separated by the sternoid. The termination of the subclavian vein and the start of the brachiocephalic vein more laterally to the clavicle arches in front of the trunks and divisions of the brachial plexus and the third of the subclavian artery. The subclavius is inserted in the subclavius groove that is present at the inferior side. That is the subclavius groove, and the subclavius muscles was going to insert here. The posterior lip of the groove is continuous with the conoid tubercle. We're going to conoid tubercle. A nutrient foramen is found in the lateral end of the groove running a lateral direction. The nutrient artery is derived from the suprascapular artery. When we are going to see about the sternal end, directed medially downward and forward and articulated with the clavicular notch of the manubrium sterni. It is the quadrilateral in shape and sometimes it's triangular in shape, and its uppermost part is slightly roughened for attachment of the intraclavicular ligament and the sternoclavicular capsules and the articular discs. Upward beyond the manubrium sterni, it can be felt and be seen easily, forming the lateral wall of the jugular notch. So, at the lower part of the thyroid cartilage of the larynx and the brachiocephalic vein, The external end of each clavicle thus form a guide to the jugular notch. If the external end of the clavicle is displaced backward by traumatic or it can be by the dislocations, the landmarks of the notch are lost, the trachea is displaced, and there will be a difficulty in breathing. If the trachea is displaced to one side, the features of the larynx cannot be palpated readily. If we are going to know about the ossification centers in the clavicle, so it's a special characteristic of the clavicle that it's having the two primary ossification center, medial and lateral, that appear between the fifth and sixth week of the intrauterine life and fuse with the fourth fifth days. Cartilage then develop at the both end of the clavicle. The medial cartilaginous mass contributed more to the growth in length than does the lateral mass. Two centers of ossifications meet between the medial 3/5 and lateral 2/5 of the clavicle. A secondary center for the external end appears in the late teens or even early 20s, usually 2 years earlier in females. Acromial secondary centers sometimes develop at around 18 to 20 years, but this epiphysis is always small and rudimentary and rapidly joins the shaft. Growth is usually completed by 23 years in both the sexes. That's all for the clavicles.